Okay, thank you. It's both honor and privilege actually to be part of third in the series of stroke forums that are happening around the region. So the first one, I have nothing to disclose regarding this letter. So this is the guy who is actually guilty for organizing first stroke forum. So Vladimir Kalosek actually was the chair of Eastmint committee, and he came out with the idea of organizing stroke forum in Sarajevo. At that time, actually, stroke forum was invented by me, but at that time we were discussing about organizing a conference in Sarajevo, and before that, actually, we had only one neurointerventional conference in Sarajevo in 2019, and Professor Radoš was there, and I think these were actually the first topics presented to a general audience about stroke management. At that time, obviously, in Bosnia and Herzegovina, nobody performed stroke procedures. So I was in Washington when he actually pressed on me when we are going to organize and so on and so on. So it happened in June 2022 in Marriott, and it was pretty well attended. It was we were thinking about actually inviting neurologists first because it was really important for us to hear about stroke management from the experts who are actually performing it. So some neurologists actually came, some anesthesiologists came, and we invited people from the National Health Funds, and nobody actually showed up from them. So this was the first one, and then next year, this idea actually kick-started throughout the region. So this is the second one in Belgrade, one of the lectures there. So 10 years ago, we are actually celebrating anniversary this year. So it's 10 years of successful results being published from 5 different major studies. Some of them actually ended prematurely because of the obvious benefits of stroke, especially for the acute large vessel occlusion in anterior circulation, as it is shown here. So these studies actually did not show any significant benefit out of from thrombectomy, but they were actually redesigned, and these studies. Okay, sorry. I think I'm lacking one slide. So unlike these studies are from 2013 that actually did not 2015, that actually did not show the benefit for the posterior circulation, and this is being improved with the latest studies, Attention and Bouch, that actually proved that there is help even for this patient. And I showed these slides because of the duration of time from stroke onset to groin puncture and to revascularization. So in posterior circulation studies, you have patients tend to come in prolonged time manner, so you have more time actually to conduct what you need to. And why is I'm speaking this? Because of this. So unlike in Croatia or in other countries of regional countries or European countries, we tend to give IVT treatment to a substantially low proportion of the patients. So these are actually the data from Clinical Center University of Sarajevo. So if you see, it's a staggering number of actually only 2 patients that actually received IVT in 2024, and you have ischemic stroke cases approaching roughly 1,000. So really small population actually gets IVT. And why is that? I don't know. This is actually explanation by neurologists a few days ago. So they tend to come late for thrombolysis. I'm not sure that this is the only explanation. So for me, I think that they are actually afraid of intracranial hemorrhage, which of course happens there. So only IVT until 2021. We had sporadic rescue MTs in our interventions. One was performed with Zoran Milošević here in 2019 or something. So first independent mechanical thrombectomy in Bosnia was performed in Sarajevo in 2021, and we actually did not lead in this number, so we were it was a matter of 1 year. We were overtaken by Mostar, other comprehensive stroke center in Bosnia and Herzegovina in number of procedures. So here you can see that in the last 3 years it was 155 thrombectomies in total, and Mostar actually performed more thrombectomies than we did. So this was the first one. So it was, from today's perspective, it was a pretty easy case, and we were actually quite content with the end result. Of course, I will show you the images later, and I actually encircled the day that when the procedure was actually performed, and it was only 1 day before her birthday of the patient. She was a mother of 2, and she was substantially young patient, as you could see. Of course, we did all by ourselves. So we actually indicated that the patient, we set the radiologist set the indication for the thrombectomy. And we actually managed to transfer the patient from emergency medicine department to radiology, and then we actually spoke to a neurologist for half an hour, and the patient was actually transferred to emergency medicine department again before admitting to neurology department only 3 hours later. So we were stubborn, they were stubborn, but we were more stubborn, obviously. So it was an easy case. I randomly do aspiration. This was, of course, this was direct aspiration, so it was the first case, so we were a bit afraid, but it was super easy, and the result was actually MRS 0 upon the discharge, and I think discharge happened 7 or 8 days later. So here, this is the map of Bosnia and Herzegovina, and here you can see encircled in red 2 actually comprehensive stroke centers. Actually, the centers, clinical centers that have capability of becoming comprehensive stroke centers, and they are becoming right now, so they have everything that is needed for. We have 2 major clinical centers in the northern parts of country. However, they do not perform thrombectomies, and I'm not sure about the number of the patients who are actually receiving IVT as well. So they have the potential to become comprehensive stroke centers, and there's some hospitals such as Bijeljina Hospital, which can be, and Bihać Hospital, that can be actually primary stroke centers. Of course, infrastructure is not as good as in Croatia, so it's really, so you have, mileage is not high, you know, but it takes substantially more time for the patient to actually present within the golden hour to comprehensive stroke center, and so the situation is actually as it is. So what are the challenges that we actually faced so far? Of course, recognition of the procedure by the clinical centers in Sarajevo and Mostar happened in 2022 or 2021 in Mostar. I really don't know. But it was not hard actually to do that. So all you had to do was actually to create a protocol for mechanical thrombectomy, and it was adopted by clinical center, and you had like a specific code of this medical service. However, it's not enough, obviously, because someone has to pay for the procedure, and our national health actually only recognizes 3 reimbursement codes, and these are for embolization of cerebral blood vessels, stenting and coiling of brain aneurysms, and carotid artery stenting. So whenever you do actual mechanical thrombectomy, you have to present it as embolization or something else in order to be reimbursed. You know, sometimes it is possible, sometimes it's not. It depends on the clerks who are actually receiving your documentation about the case. So the latest meeting actually happened on Fool's Day this year, and we have new promises to act from their side to act faster in obtaining the reimbursement code. Now they're actually aware of it, but I think their major concern was about the economics, because they do not understand that actually thrombectomy works and it is cost effective. So you have different studies, like this one from Stroke in 2021, which actually proved that this method is cost effective for all countries but Bulgaria. Or this that actually says that you actually save the money by doing thrombectomy in long term, of course, having in mind quality of life years. So I asked ChatGPT, how can we improve the number of thrombectomies, and what has to be done? So this is convenient sound. It's not from the presentation. So it's obvious. Early recognition of stroke symptoms. It's something that, in my opinion, has to be applied by emergency medicine staff. So, of course, and you have, and ChatGPT listed the number of things that should prompt your medical attention to get the patient to comprehensive stroke center. And then stroke code activation. We don't have stroke code. So stroke code in Sarajevo is actually calling on the phone someone else and saying, okay, there's a possible patient for this and that. It's not like that in Mostar, because they have introduced system that we didn't purchase yet. So after that, it gets easy from our perspective of the people who are actually performing this procedure. So what about the urgent imaging? It's not a problem. So we are well equipped with everything. Of course, medical stabilization is something that neurologist, intensive care neurologist actually has to be responsible of, as well as administration of IV thrombolysis. And these things are actually not as good for us as for Croatia with Dr. Peljakovic, or Mostar with Dr. Bender. And so we do not have that sort of neurologists so far. And of course, rapid transfer to endovascular suite or stroke center. I will show you our metrics from last year. So it's super easy if you follow some sort of protocol. So and these time goals are actually listed here. Are time goals from obviously not from Bosnia and Herzegovina, so only 90 minutes from the door to recanalization. Or here, these are all, these slides hide the answer about reorganizing stroke care in Clinical Center Sarajevo. So here, for example, you know what actually emergency department medical doctor does, what does resident or neurological resident, so everybody has its part of the job in management of the patient before imaging, which was actually established in Clinical Center of Sarajevo in 2022. It is actually placed on the walls of each city unit in Clinical Center in Sarajevo. However, I usually get the call, how should we proceed with the imaging? So it's on the wall, but it's invisible. I don't know how. So, okay. Of course, we have inter-hospital protocol, which was actually there from 2022, but in 2023 it was it became mandatory. And of course, I think the only persons who actually read this protocol are these persons who actually wrote it down. So everything is there. So what are stroke metrics for 2024? So we performed 13 thrombectomies. Answer to door is unbelievably long. Door to CT varies from 10 to 79 minutes in these 13 cases. So in average it was 42.7 minutes. Why? Because we have a lot of patients with posterior circulation stroke. They're perfect candidates for thrombectomy, unlike anterior circulation stroke. And door to groin is actually quite big. So if you exclude CT, from CT to groin, it's quite long, and we need to actually figure how to reduce this. And I think this is actually the job for the neurologist. In Mostar, door to groin average is 110 minutes. So I think, as Gojko told me a few days ago. So we are really, maybe we were smart, because we were waiting for the positive results by the studies on treating the patients in prolonged time window. They were all actually showed that it works, and maybe this is the reason why we are actually dragging and prolonging the time from obvious diagnosis to treatment. So one of the cases of pediatric stroke, 10.5 hours. No, he fell from the chair, nothing. He got CT, somebody actually didn't see the thrombus in distal in basilar tip, actually. So then MR was performed, and at 9 a.m., so we entered at 10 or something in the angio suite, and it was super easy, again, only direct aspiration. This was the end result, and this was the kid actually 1 month later, so everything was cool, and some heart anomaly was found. So of course, it's not always as good, especially with the posterior circulation stroke. So another patient, first patient performed transradially. So he had, I don't know, bilateral occlusion of common iliac artery. So we had to go transradially and entered further right. One performed stent retrieval plus aspiration, balloon angioplasty, so everything looks quite neat. However, this was actually pre-CT, so obvious their situation, of course. You have pressures from family, from, I don't know, there are a lot of VIPs in Bosnia, so you need to act when you're not feeling that you need to. And the result was MRS-6 actually at the end, even though the result was pretty nice. But if you look here, it was not that nice. You had snowplow effect actually, and there's no ICA anymore on that side. And the one usual case that we perform, this is actually the last thrombectomy that we performed 15, 20 days ago. So I use mostly stent retriever and aspiration, so puff and fluff, and only one pass, and that was it. So the patient actually was good after discharge. So if you look, so I asked ChatGPT again about annual stroke incidence in catchment area of roughly 1 million, which is catchment area of Sarajevo region. And it told me it's 200 to 500 possible mechanical thrombectomies per 1 million population. And this range actually depends first on public awareness and pre-hospital stroke triage, and of course access to imaging and early intervention, which is already there. So are there ways to improve? Of course there is. So we are lagging, trailing England, but I realized today that we are not that much behind them, for example, unlike continental Europe. Why? Because Professor Radoš and team from Zagreb actually created a TV commercial 3 or 4 years ago about the necessity to report quickly if you experience the symptoms of the stroke. NHS actually released this campaign last November. Then there is the need for speed of EM service and to know what they're actually doing in Sarajevo. They do not bring the patients timely to the hospital. How can we solve it? I think one of methods when the patient is in hospital is actually to introduce AI, because somebody has to read CTs and CTAs, and usually, obviously, there are not too many of us who actually know how to read maybe correctly with the mindset dedicated to possible thrombectomy. So this is, for me, I think it's a cool way actually to bypass this problem and somehow to actually force neurologists to go into the procedure of thrombectomy. So many ways actually are there to improve. Some are not up to us, or maybe in some percentage they are. And I think, and we already actually overtook some steps in qualifying our neurologists to act according to ISO standards. So they are actually started to attend these courses with the public campaign, which will be the next thing that we are going to do, and I think it's going to be launched in autumn. And what about us? So, of course, I think we already passed everything about theoretical, and we have practical knowledge of stroke management. And of course, it's always good actually to remind yourself and to enhance your skills even more. So one of us is going to attend this skills meeting in 2 months from now. So this is the last image instead of thank you note from our Congress that was organized 5 or 6 months ago in Sarajevo. So we actually formed a Society of Interventional Radiology in Bosnia and Herzegovina, and here you can see all guys who are actually performing interventional radiology procedures in Bosnia and Herzegovina. So there's no one else who actually knows how to deal anything regarding interventional radiology, except maybe for three neurosurgeons from Tuzla, or obviously not here. Out of these people, only 4 people are actually involved in, 5 people actually is involved in neurointerventional procedures. So thank you.